Hi, my name is Dr. Taylor Van Weinboom. This is video number 2 on our peripheral neuropathy series, where we'll be going further into the disease itself. So what we'll start off with is, how do you know if you have peripheral neuropathy? And this is a general overview, but usually you have basically 10 signs or symptoms that can go along with peripheral neuropathy. So numbness, burning in the feet, cramping, sharp electrical pain, pain with walking, difficulty sleeping from pain in the legs or discomfort, prickling/tingling feeling in the feet or hands, loss of balance and falling, weakness in the feet and legs, and swelling. So I know it's kind of broad, but those are some generalities that'll kind of point you in the right direction of maybe I should get this checked out. So we'll go into different reasons why you'll have different symptomatologies. So there's different nerves that are affected. You either have your sensory nerves or your motor nerves. So your sensory nerves do just that, sensation. So if I touch my hand, I can feel that sensation. So, it goes from my hand all the way up to my brain. Or if you have, say I wanted to pinch my hand and make it hurt, same idea. So those would be sensory. And then you have motor, which controls actions, what you're doing. If I'm walking, if I'm moving my fingers, those would be actions. So we're going to dive into sensory. So there's two different parts. There's more than two, but these are the parts in general that can be affected with peripheral neuropathy. You either have what are called large diameter afferent nerves or small diameter afferent nerves that can be affected with neuropathy that give different symptomatology. So large diameter afferent nerves, if these nerves are affected, you have numbness or the inability to determine joint position. So numbness is just that. You can't feel sensation of that. You have inability to tell joint position because you have numbness. So these are the people that you see going around walking that kind of slap their feet on the ground just so they can get some kind of sensation going up through the legs to see where they're at in space. Otherwise they have to look down to see where their feet are at because they don't know otherwise, which is a big issue because it causes balance problems. And currently falls are the leading cause of death due to injury among the elderly. So that's a big issue. So now if we look at the small diameter afferent nerves, like we say, they're more related to pain. So if these nerves are affected, they give you more of the pain/burning sensation that you'll see with peripheral neuropathy. And this is why people can have pain and burning and not numbness, or they can have pain and burning and numbness or just numbness. It really depends on the nerve fiber that's affected. So you might hear this referred to as diabetic nerve pain, which is just peripheral neuropathy due to diabetes causing nerve pain. A lot of times you hear these people say that they might start walking on their carpet without socks and it feels like they're walking on pins and needles or glass, or their feet are on fire all the time. So maybe at night when they lay down, the covers on their feet, it's too much pain. They have to pull the covers off, those kind of issues. And then you get into the motor nerves, which control the actions of the body, like you say. So this interferes with the muscle control and can cause weakness, loss to muscle bulk, loss of dexterity, and sometimes cramps can be a sign of motor nerve involvement. So for many neuropathies, symptoms often begin in the feet and progress towards the center of the body with involvement of other areas of the condition as it worsens. So usually, say my hands or foot, usually kind of starts in the ball of the foot and kind of spreads out from there, whether it's the pain or the numbness or loss of motor control, say the big toe. And then the numbness spreads through here and it spreads up the foot, up the ankle, up the leg, and can kind of progress that way towards the center of the body. These are the people that you might see being in wheelchairs due to peripheral neuropathy or have to use a cane, due to not being able to see where or know where their feet are at or losing the motor control. So what's the problem with the current model of treating this? The medications don't do anything to address the reason why you're having the issues. So, what happens is the nerve is dying, So if you're taking your gabapentin, your Lyrica, your Cymbalta, your Neurontin, what they're doing is they're symptom-based. They're trying to quit the symptom signals to your brain. So usually they deal with pain or burning. They don't deal with the numbness or the motor control issue. So what they're trying to do is just quit the pain signal to your brain. The issue is, yeah, that's great. It'll help manage you through the day, but the condition continues to progress. And then you get the other symptoms, other nerve involvement, and then you have bigger issues like the falling or the balance, which aren't being addressed at all on the medication. So the disease continues to progress, and then yeah, you might end up in a wheelchair. You might end up using a cane. That's not the goal. Typically you only get one trip around this thing called life. And somebody that has peripheral neuropathy is maybe in their, what we might classify as their golden years, because you're typically older. You don't have to be. And that's the time you're supposed to be enjoying your freedom, going on trips, doing things you enjoy, maybe playing with the grandkids, So I would ask, can you do that? Can you enjoy your life? What are you missing out on due to this disease? So if you have any of these signs or symptoms from above, I would encourage you to come in to the office, get evaluated, and see if we can help you. I'd love to see if we could help you overcome this disease and get your life back, because it's not a way to live, stuck in a chair or stuck, with pain every single day. And there is relief out there. A lot of doctors will say there's nothing you can do besides take this medication. Not true. Absolutely 100% not true. Don't listen to it. So I say, please come in here, get evaluated. If we can help you, we will. If we can't, we won't. And we'll tell you that. But either way, this is our second video on our peripheral neuropathy, and we'll keep coming out with more, give you more information on the disease itself, and hope to catch you next time.